Natalie Ratcliffe wants a well-funded NHS for her family's sake, but she fears the plans to shut her local A&E are just the beginning.
I think the NHS has been disseminated slowly. It's happening in all sorts different local areas, Wythenshawe, Horton, all over the country. And I think it's time that we have to unite so that our voice is bigger.
The voice of the campaigners like Natalie opposing the closure of accident and emergency in Huddersfield has been loud and clear since plans to send patients to Halifax were revealed. A national campaign group says there are other changes and cuts elsewhere on the cards.
In Leeds, we've had a plan leaked to us that reveals the proposals on the table to cut the equivalent of 5 hospital wards worth of beds. As an NHS patient, they are pretty scary decisions.
The Leeds Hospitals Trust insists that any reduction in beds would only happen if patients could be cared for at home or in the community, and it says it would consult the public. But GPs are concerned that they're not being asked about the plans and that they simply don't add up.
We've been told for years that the best way to restructure the NHS is to localise it, to make services available locally for people. And yet at the same time we're being told that the way to progress the NHS is to make supercentres in the middle. And you can't really do both. So what I would like to see is good evidence to show that these changes will actually be beneficial for patients, not just cost-saving exercises.
The financial cost is important because everything has a financial limit. And the citizens of this country have a financial limit on how much they're prepared to pay for their health and social care.
Public consultation about what's happening in Huddersfield has so far prompted widespread opposition from patients. There are fears that there's a widening gap between what the NHS has been asked to do and the money made available to carry it out. The future of this hospital and its accident and emergency department will be known in October. Campaigners against this closure believe that they'll now see more similar battles being fought across the country. Katie Oscroft, ITV News, Huddersfield.